Hi everyone, I'm Nurse Johnson. Welcome if you're new to this channel, but you've missed a lot. And if you're an old timer, welcome back. Now, today is unlike any other day because in this episode, we'll be having the opportunity to feature one of our own from the very nursing community. Okay, this person is well respected, well known, and also a registered nurse as I am. Now, the surprise doesn't end there. And do you know why? Well, the reason is because in the coming weeks, we'll be having the opportunity to feature and interview registered nurses that are living outside the country, especially in the US and the UK. Now, I know some of you are kind of excited and also surprised. Yes, it's true, we'll be interviewing nurses who are living abroad from next week, guys. Yes, you'll be seeing them live on this video. We're talking to them, interviewing them, asking them a lot of challenging questions. And the reason we are going to be doing that is because we want you guys, or nurses or aspiring nurses and student nurses, to have a feel of what it means to be a nurse, to have a feel of what it means to live abroad, and to understand the difference between the practice at home here in Nigeria and abroad over there. Now, this is the moment you've all been waiting for. So before we go on to interview our guest, we'll be taking a short break and we'll be back before you know it. Coming up. Okay, welcome back, guys. So let's get started with the order of the day. Welcome on the show, sir. We are very excited to see you. Our viewers are also excited. Can you briefly tell us about yourself before we get started so that others watching you can get acquainted?
Good morning all. I am Nurse Prince and I will be answering questions pertaining nursing and some personal life experience in College of Nursing and Midwifery, Yola.
Once more, you are highly welcome. So from what you said earlier, you are a nurse from the College of Nursing and Midwifery, Yola. And that's great because we've heard that students that come from that school are actually doing well. And the school is also doing well on a national level. But can you briefly tell us what drew you into the nursing profession? Like, why did you decide to study nursing in that school instead of maybe engineering or any other course, for example?
I can't say this is the main reason I joined College of Nursing and Midwifery, Yola, because as of then, I didn't have any passion for the school. I was so naive. I thought that the school is only for females, so I didn't have any passion for the school at the first time. But along the line, I came and developed a passion for the school. I liked the school, and the school really helped me in my life.
Wow, you develop passion for it. Well, that's very rare. Anyway, are you saying that you've been a study junkie in all your years at school? Like, can you tell us for how many hours you do study when you were a student? Like, how many hours?
Okay, I personally do not have a reading hour, or I do not calculate hours while reading. I make sure that I understand the basic. So my advice to you guys is that when reading, you should not just be calculating hours. You should make sure that you are understanding what you are reading. You can't just spend 3 hours, 4 hours, or 5 hours reading and still you don't understand anything. So make sure that in all that you do, you should make sure that you are understanding what you are reading.
I think that's a huge advice right there, sir, because I think there's a kind of major misconception that it's among our students lately that the longer time you study, the more susceptible you are to understand what they are reading. And I think that kind of thought is very wrong, and you've nailed it here, sir. And as you said, students should be more focused on, you know, understanding their subject matter than just, you know, counting hours for the sake of doing so. We do appreciate it, sir. Thank you seriously. So, sir, there's this misconception raging recently. There are many students who haven't yet decided on which course to study. Some are either on two sides, medicine or nursing. So what do you have to say to these students? What should they study? Should they study medicine or nursing? Which is more profitable?
For me, when choosing between nursing and medicine, for me, you should just go for the one that you have passion for it. Although in this country, people usually attach their passion to profession that usually pay a lot of money. And in this country, you know, the doctors receive more money than other professions, and people are rushing for the medicine. Okay, let's make it this way. The nurses are to receive much more than any other profession in Nigeria. Just give it a minimum of 3 to 5 years. You see how people will be rushing to choose the nursing profession. So you should just go for the one that you have passion for it.
Now, there's this fact that has been disturbing me for long, and I'm very happy that you are here with us. There's this kind of misconception or misunderstanding amongst new students who are not yet nurses, for example, that once they graduate from nursing school, they will become millionaires or they'll be dancing in a lot of cash. So can you just shed some light on how much nurses are paid in the hospital, in the clinic, or just anywhere? Just shed some light and talk about it, sir.
Okay, when comparing the amount of money this country used to pay and the amount of money other countries or other neighboring countries used to pay nurses, there is a very big gap. Why? Because in state specialists they used to pay around 50 to 60,000 registered nurse, and in the FMC they used to pay around 80 to 90 or 80 to 100, which is very small money. The reason why some of us used to see this money as a big money is because we are not being exposed to large or huge amount of money. Just think of it as you going abroad and getting paid with the amount they used to pay nurses abroad. You understand that this country do not pay nurses handsomely.
I'm very sorry for chuckling, sir. It's just what you said, that the reason why some nurses or some people feel that these amounts are very large is because they've never held, you know, a larger amount of money than they actually have, and that's actually funny. And I think you are telling us the truth that when you compare the pay of nurses here in Nigeria with those abroad, it's simply nothing to write home about. It's just like nurses here are just collecting peanuts, and I think you're just asking our students indirectly to move abroad once they study. So are you saying that, you know, our students shouldn't, you know, practice here in Nigeria? Anyway, forget about the question. Okay, sir, we know that surely you are a very busy man and you have a lot of things to do. But before you leave the studio, can you please briefly, just in a minute, can you advise our students watching us, those watching us? Can you please, you know, just drop a word of advice for them?
Students from College of Nursing and Midwifery, not only College of Nursing and Midwifery, but other colleges across the country and also across the nation, is that you should make sure that you know what brings you to that school. Because I can vividly remember the first time I set my feet in that school, there is this one senior that told me that I will be weeded from that school. So I took it as a motivation, and now I'm done. Now I am done with the school. So you also can do it. Wish you success. I remain Nurse Prince Jackson, and don't forget to like, comment and share this video. Thank you for your time.
Thank you very much, Nurse Prince. It's been a pleasure having you. Seriously, we are really blessed by you. Okay guys, you've heard everything from the bull's mouth. You've heard everything. So please guys, don't forget to like this video, share it, and also comment. So check us out. I remain as Johnson. Peace.